Hey, physiology peeps. Welcome to lecture 2 from the chapter 4, part 2, central nervous system physiology. Okay, we're going to pick up. We finished the cerebrum last time. We're going to pick up with the diencephalon. So I'm going to share my screen and we're going to start. Okay, so, all right, there's a lot going on in the diencephalon, but I'm going to cover just a couple of things just to kind of keep it simple. But I talked a little bit last time about the thalamus and how it kind of acted as a post office station where sensory information and other information that's coming up the spinal cord goes to the thalamus in the brain, and it gets sorted to where it needs to go to be interpreted, okay? And then when motor commands come down, they go through the thalamus and they get sorted to where they need to go as they're descending down towards the spinal cord. Okay. And so my next image will show an example of that pathway of information going up to the thalamus and down through the thalamus. And then we talked a little bit last time about hypothalamus. Well, we're going to talk a little bit more about neurons there shortly. So let's look at an image of how information travels up the spinal cord. So in this image down here at the bottom, we've got a cut through of the skin, the integument. And what this is supposed to imply is something about sensory perception. It could be touch, pressure, vibration, pain, anything like that, okay? And that sensory information is picked up from the integument, from sensory neurons. That information goes in the spinal cord, goes in the backside. It ascends through the spinal cord to increasing, or let's say ascending brain regions. So it goes up through the medulla, goes up through the pons, goes to the midbrain, goes to the cerebrum, and it goes to not the cerebrum, but it does, but it starts at the thalamus. At the thalamus, notice that that information now gets sent to a part of the cerebrum where it has a cortex to receive and interpret that information. So if you remember from the first lecture, if it's sensory information, what part of the cerebrum has a cortex that is specialized in sensory perception? If you said the parietal lobe sensory cortex, you're right. Ding, 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 ding. That is where this information is going. Parietal lobe sensory cortex. Now, not shown on this image, but imagine it. If we had a motor command coming from, not shown here, the frontal lobe motor cortex, that information would come down, it would go down to the thalamus, and that might get sorted to different parts of the brain, like maybe some of it will go to the caudate nucleus. Maybe some of it will go to the colostrum if it's about visual feedback. Maybe some of it will go back to the cerebellum for balance. And then that information comes down the spinal cord and goes through decreasing regions of the brain till it hits the spinal cord, and then it'll come out the spinal cord and it will go to a muscle or a gland. Okay, well, that's the diencephalon's role of the thalamus. Okay, let's go on to the hypothalamus. No, you're not going to have to memorize this image, but it shows you that there's about 9 nuclei in here, and I've starred or asterisked some of them that I'm going to cover. Okay, so the thalamus is very important. It has nuclei that control very important bodily functions, most of them, well, all of them actually, autonomic. Okay, 1, the supraoptic nucleus. Is your body's osmolarity sensor. That's balance of water. Basically, it's going to produce a neurohormone called ADH. ADH stands for anti-diuretic hormone. All right. So when I think of the supraoptic nucleus, I think of the O that is there, and I think of H2O, water. Okay. Basically, what this hormone is going to do, it's going to cause your kidneys to retain water, so you don't pee it out in urine and lose water. So you're going to conserve water using this nucleus and this hormone. Okay, next, the paraventricular nucleus. We learned this all the way back in chapter 1 when we talked about the hypothalamus produces oxytocin. And if you remember, oxytocin is a very important hormone in milk letdown for women who are breastfeeding a child, and also pretty important in causing major contractions of the uterus during childbirth. So that's that nucleus. Next, the anterior nucleus. Well, that is your body's temperature sensor. So back when we talked about in chapter 1, negative feedback regulation of body temperature, When your body senses that your body temperature is too low, outside the normal range, or too high, this nucleus has kind of like a normal range. And when your body goes outside of normal range, it will cause your hypothalamus anterior nucleus to either, if you're too cold, stimulate skeletal muscles to shiver for warmth, or if you're too hot, stimulate sweat glands to secrete sweat to cool you down. So when I think of the anterior nucleus, I think of the letters A and T, and that reminds me of Antarctica. Antarctica is a continent, and it's a cold continent, and cold is a temperature. So I think of anterior, Antarctica, cold, temperature. All right? Next, the ventral medial nucleus. This is doing a lot, okay? So it's got a fullness center. It's got a center that when you're hungry, you seek out food. It's the center that controls, or the nucleus that controls your fight, flight response. When you're in danger, your sympathetic response. And it also controls all things reproductive, okay? They say the brain is the sexiest organ. Well, it's true. The hypothalamus through this nucleus controls all reproductive functions. Okay, so what were the 4 F's? And this is what the ventral medial nucleus is important in. Well, one, if you're scared or you want to fight, your fight flight system, okay? So if you're cornered, you'll defend yourself. If you can get away, you'll flee. Now, the other thing it controls is feeding. So when you're hungry, you actively seek out food. It's a very strong impulse. And then when you're full, this nucleus is supposed to say, okay, you're full, time to stop. All right. And then lastly, reproduction, but I use the safe F word. All right, moving on. Kind of a redundancy in the system, but the lateral nucleus is about hunger regulation. And so when I think about that, I think of diving into a piece of cake, but I think about the letters A-T-E, which spells 8, right? So I think of hunger, I think of eating. So the lateral nucleus has the letters for the word 8 in it. Okay, the preoptic area is your thirst center. When you're dehydrated, you're thirsty, and we've all been there where you're thirsty, and all you can think about is a cold, cool drink. So it's a very strong impulse to drink when you're dehydrated. And then lastly, the suprachiasmatic nucleus is all about your sleep-wake cycle, your day and night cycle. It's called a circadian rhythm, all right? But basically, it's your sleep-wake cycle. Okay, so that's enough of the hypothalamus for now. All right, let's move below the diencephalon and go to the midbrain, shown here boxed in, okay? Now, the midbrain has lots of nuclei involved. Now, in anatomy, in the posterior part of the midbrain, you learn this upper bump here, what's called the superior colliculus, superior because it's higher, and the bump below it is the inferior colliculus. So if they probably didn't teach you in anatomy, why those centers are important as a brainstem function. Okay, the superior colliculus, the upper bump, is controlling your reflex tracking of moving objects. When you drive anywhere, you're probably not aware of it, but you're unconsciously or subconsciously, no correction, subconsciously, you are tracking moving objects around you. So you're looking at the oncoming traffic, and if you notice it's going to start veering into your lane, you are going to take quick evasive action that can save your life. Likewise, if someone throws a ball at you, you're tracking that object and you're seeing, is it on a trajectory to hit me? And if it is, you go and you duck, right? And you don't think about that. It's a reflex. So the superior colliculus is about tracking moving objects because that can protect you. So I've got a little GIF here of someone who's throwing a ball, and then the person over here has got a malfunctioning superior colliculus because they're not getting out of the way. All right? Okay. The inferior colliculus is about reflex responses to sound, especially unexpected sounds or sounds you've learned could be a danger is coming. So we've all done this. You're crossing a crosswalk. You got your face in the phone, right? We've all done it, right? Okay, so you're not looking. And all of a sudden, the car is coming to the crosswalk, and it lays down the horn, right? And you go like this. And all of a sudden, you turn to the source of the sound, and you're now directing all of your senses at a possible source of danger or a life-threatening danger. That's a reflex. You could be sitting in a classroom and a fire alarm goes off and you go, what? Okay, that reflex turning towards the source of an unexpected sound or a dangerous sound is controlled by the inferior colliculus. So in this next gift, I have two guys who are walking in a parking lot, and there's a guy behind them in a truck who's laying on the horn just to be a jerk, really. But not only do they turn reflexively to the source of the sound, they actually fall down. They're so shocked. So here the horn goes off, and boom, they turn and look to where the sound comes from, okay? All right, so how do you remember that the superior colliculus is about visual reflex and the inferior is about auditory reflex? So if you look, what is higher, my eyes or my ears? And if you look, your eyes are a little more high. They're a little more superior. So remember, superior colliculus is a reflex response to vision, and the inferior colliculus is a reflex response to sound, right? All right, great. Okay, the red nucleus. I've got a cross section to the midbrain here, and the RN stands for red nucleus because it's pigmented red. This nucleus has autonomic control of posture muscles that help you keep your balance. So it's kind of control of core muscles. Okay, next, look at this gift. So when you're doing core balance exercises, think of the red nucleus in the midbrain, okay? Because those core muscles are contracting on and off to keep your balance, okay? Now next, the substantia nigra, little blue SN here and here. These are pigmented neurons that if you were to put someone in a CT scanner or an MRI, this area would be darkly colored because the neurons are pigmented. Well, this part of the midbrain, the substantia nigra, produces dopamine. Now, back in the chapter 4, part 1, the neurotransmitter chapter, I talked about how dopamine is important for fine motor control. So your movements are smooth and not herky and jerky. People who have low dopamine often have Parkinson's disease. In fact, people who have suspected Parkinson's disease, you can put them in a CT scanner, look for this area of the midbrain, and if these nuclei are bleached out or the neurons have died, that could be diagnostic for someone with Parkinson's. Now, another thing that dopamine is important in is your reward center. So when you do something that feels good, you get a little release of dopamine. In fact, drug use releases dopamine. And what happens is that when you do something that feels good, you get a dopamine release. It's like getting a neurotransmitter cookie. And you're more inclined to do that behavior again and again and again. Okay. Okay, now also part of the midbrain, up here, the box, the midbrain, this purple line, this streak, goes through the midbrain, goes through the pons, and goes through the medulla. This is the reticular activating system, and we'll cover that soon. Now, dopamine release and drug abuse. All kinds of drugs. In fact, food addiction, sex addiction, whatever people's addictions are, they become psychologically addicted to certain things because of a dopamine release. Every time they do it, there's a dopamine release, and it reinforces them to that behavior again. So all these drugs, nicotine and cigarettes, very addictive. Heroin, morphine, all those drug pain medicines, pharmacological drugs to treat pain. We have an opioid addiction problem in this country. So those opioids they prescribe to treat pain, well, guess what? They relieve pain and you get a nice dopamine release, and then there can be psychological addictions to them. Valium, which is a muscle relaxant, causes dopamine release. Cocaine, amphetamine, methamphetamine, speed, all that stuff increase dopamine or cause a dopamine release. Alcohol, same thing. And all of these things have strong psychological addiction components to them, okay? And you can read the clinical app on this, the positive reinforcement from addictive substances. They cause dopamine release. Okay, moving on to other parts of the brain stem. The pons. The pons right here has two respiratory centers that are for autonomic control of your breathing. Now, the medulla actually controls the pons with its respiratory center, which I'll get to. But notice the pons and the medulla also have some of the reticular activating system. Okay, now the medulla controls involuntary sneezing. You've probably noticed that if you ever tried to stop a sneeze once it started, you almost feel like your eyeballs are going to pop out of your head. Because once it starts, it goes to completion. You can't stop it. Same thing with swallowing, gagging, or vomiting. They're autonomically controlled. Once they've started, you can't really voluntarily stop it. It goes to completion. There's also a crossover of information for motor control in the medulla. But I want to get to these centers. Now, the medulla has a cardiac center to control your heart rate, to increase it or decrease it if your blood pressure drifts outside of normal range, and that's part of a negative feedback mechanism. It also has a vasomotor center. The vaso means blood vessels. It means arteries. When your blood pressure is outside of normal range, your medulla's vasomotor center can vasodilate arteries to decrease blood pressure or vasoconstrict them, narrow them to make blood pressure go up. And lastly, the respiratory center. This is what controls the pons. Okay, so this is your brain stem. So now that we've covered all the lower regions of the brain, not all, we've got the cerebellum left, let's talk about the reticular activating system. I like this system. When you are zoned out in a classroom, I hope it's not mine, and you're not paying attention to what's going on, maybe you're starting to fall asleep, or let's say you have fallen asleep. GABA inhibits your attention to unimportant stimuli, and it also quiets your skeletal muscles so you don't get up and walk around. But if your body senses an important stimulus, a baby cries, an alarm goes off, something else, the reticular activating system is going to rouse you so that you wake up and pay attention to what could be life-threatening information. So the reticular activating system. Here's a sleepy cat. It smells tuna. All of a sudden, important stimuli, it's awake all of a sudden, right? Okay, so that's an important stimulus to a cat. It smells yummies, okay? Now, it could be a student in a classroom who's zoned out, and then all of a sudden, here's an important stimulus of the students around him and the instructor clapping, and all of a sudden, it's like, what? Oh, yeah. All right, so watch the gift. Up, sleep, up, awake. Good job, reticular activating system. Yeah, we've all been there, I know. Okay, now let's talk about neurotransmitters involved in this arousal or in the quieting down. So the reticular activating system is in the brainstem. It has 4 neurotransmitters involved. 3 of those are arousal neurotransmitters, and 1 is an inhibitory one. So acetylcholine in the brain is always stimulatory. People who have low acetylcholine in the brain often have Alzheimer's, okay? Low acetylcholine is associated with Alzheimer's because acetylcholine stimulates your brain's awareness. Now, monoamines, like dopamine, I've got epinephrine, but I'm also going to include, well, since we're talking about brain, we'll keep with norepinephrine, because that's adrenaline in your brain. Norepinephrine in your brain is always stimulatory, keeps the brain active. Dopamine keeps the brain active because when you're doing something pleasurable, dopamine kind of stimulates your brain. Now, I'd rather put this new neurotransmitter, it's hypocretin 1. They discovered this when they looked at people who had narcolepsy, which is people who fall asleep at inappropriate times, like driving a car or eating. They've looked at brain scans and they found this, or not scans, but they've also looked at blood profiles. They found that this neurotransmitter is low in people with narcolepsy. So they've assumed that this is a stimulatory neurotransmitter. Okay, so 3 stimulatory neurotransmitters, 1 inhibitory one. So, okay, so The cat is the stimulatory neurotransmitter trying to stimulate your brain for wakefulness. But GABA, we've talked about that before, is an inhibitory neurotransmitter that quiets your brain to unimportant stimuli and makes your skeletal muscles quiet when you're in deep sleep. Now, I have a clinical app. If you're looking at this PDF online, you'll be able to look at it. But there are drugs that affect your reticular activating system. And here it is. So stimulant drugs, nicotine, cocaine, amphetamine, methamphetamine, speed, enhance dopamine action, which is stimulatory in the brain. The antihistamine, Benadryl, basically causes drowsiness by inhibiting your reticular activating system. It also blocks acetylcholine in your brain. So Benadryl is doing two things. Inhibiting acetylcholine, that is basically inhibiting the reticular activating system, making you drowsy. And Valium, the muscle relaxant, stimulates GABA, okay? And that can make you drowsy also. Okay. All right, last brain region, the cerebellum. And I've got someone doing yoga because it involves balance. And your cerebellum does many, many, many things. But I'm going to focus on fine motor control, balance, and muscle memory. So what is muscle memory? Well, if you've got on your phone a password pattern, do you have to stop and think about it, or have you got that sucker memorized and you're on autopilot? You're just, and it's open, right? Or how about this? How about when you ride a bike? Well, you learned to ride a bike when you were young, and let's say it's been 10 years since you rode a bike. Do you have to relearn riding a bike? Or you can pretty much get on the bike and the muscle memory is there, right? You kind of remember how to do it automatically. That pattern of muscle movements involved in balance, such as on a bike or a rollerblade or a skateboard or whatever. Once you've learned the muscle memory pattern, you don't have to relearn it. It's there. Have you ever gotten a rental car? Like in my car, the gear shifters have steering wheel. And when I get into a rental car, often I'll automatically reach up for the shifter and it's not there. And I look down, oh, it's got it down between the seats. It's one of those cars. But me automatically, without thinking, reaching up, that's muscle memory. That's stored in your cerebellum. Okay. Now, people who have damage to their cerebellum, maybe from brain injury, from a stroke, or maybe they were born with it, okay? Damage to the cerebellum can lead to motor deficit, all right? So cerebellar ataxia. Ataxia is basically uncoordinated muscle action, okay? And it can happen, you can be born with something called cerebellar hypoplasia. Cerebellar hypoplasia. Let's look at that for a sec. I'm going to keep the ink and I'm going to look up online a cerebellar hypoplasia. I know this because animals are born with it, and so can people be born with it. And what happens if we look at some images is, here we go. Let's look at it. So here is a view of the cerebrum, and here's the cerebellum. And normally that cerebellum should fill in this space right here, all right? And it's atrophied. Cerebellar hypoplasia results in uncoordinated movement, okay? So let's look at a video perhaps. I don't know. Hypoplasia kitten. All right, let's look at this. Undeveloped cerebellum. We're gonna have to go through the ad. Okay. There we go. The 3 cute kittens. Okay. So one of these is obviously going to wait for the sound here. They have been diagnosed with cerebellar hypoplasia, which means they're going to be wobbly kittens. Okay, so that's ataxia. That's ataxia, the hind legs going out from under them. Okay, now they say it's not a good prognosis, but that's not quite true. Because they're young, their brains are plastic, they often, more often than not, still live a good quality of life, just like people, because their brain makes adjustments and makes new neural connections. And eventually, over time, especially with physical therapy, they can compensate for that. Okay? So that's damage to the cerebellum that you're born with. Okay, so let's go back to the PowerPoint. All right. Now, often what you'll see in cerebellar ataxia, other than wobbliness, is you can have what's called intention tremors. Now, what happens is at the end of a movement arc, like I were to reach for this pen, and I had cerebellar hypoplasia. I'd reach for it, and as I got close to it, I'd miss my mark. I'd try and compensate and pull back and then go forward, and that's an intention tremor. Let's look at a YouTube video of a man who has cerebellar ataxia and an intention tremor. Okay. Okay, so he's asked to touch his nose, which we can do, right? But he does, and he misses the mark, and he tries to get back to it, and that's an intention tremor, okay? That is damage to the cerebellum. Okay. Okay, moving along. That is a great place to stop for the second lecture in the Central Nervous System, Chapter 4, Part 2. The next PowerPoint, we're going to pick up with blood-brain barriers and hematomas and why they're dangerous. So let's stop the share, and please do continue on to the next lecture, and we'll finish this chapter off.